Hello, this is Congressman Brad Sherman. Welcome to our first 2021 San Fernando Valley Telephone Town Hall meeting. We held at least 9 or 10 of these last year. We'll do a series of them this year, and we've got a lot to talk about tonight. We'll be talking about the coronavirus, the economic downturn, racism in our society, threats to our democracy, and our economy in general. First, I want to give you a phone number to write down, because if you're disconnected for any reason, you call us back at 877-229-8493, and then enter PIN number 13402. That's 877-229-8493, PIN 13402. Now, this telephone town hall operates like a large conference call. We have thousands of people on the line for these telephone town hall meetings. If you want to get in the queue to make a statement or ask a question, you dial *3. You'll be connected to my staff. If you just have a comment you want to register with them, that's fine. If you have a private matter where you need help with a federal agency, that's fine. You'll be connected to the right staff person there. Most people who dial *3 are going to want to be placed in the queue to ask a question and to be heard by the San Fernando Valley tonight and to hear my response. We won't get to all the questions. We never do, but at the end of this town hall, you'll be able to leave your question if you weren't able to ask it during the festivities. And I will not listen tonight because it'll be closing in on midnight East Coast time when you leave that question, but I will get back to you on Friday or at least by Monday. I want to point out that if we have on the line Scott Abrams, the director of our Constituent Service Office, and Carolina Kraywak, my legal counsel, they are available every day at 818-501-9200. If you're having any issue with any federal agency or any federal program, including the programs I'll outline here. But I do want to point out that we have a deliberately complex governmental structure in this country at the federal, state, and local level. It was designed by our founders who feared government and wanted to make it as inefficient or at least as divided in its power as possible. And so there will be occasions when your matter is best addressed to city or state authorities. And if that's the case, we'll tell you the right city council member or state legislator to call and the right person to call in their office. We will have back by popular demand, Dr. Lynn Goldman, who has been with us on most of our telephone town halls, and I will tell you about her outstanding qualifications in just a bit. And she is both a pediatrician and an epidemiologist. Going back to our constituent service program, if you are having a problem with any federal agency, call 818-501-9200. Talk to Scott Abrams, talk to Carolina Kraywak. They'll work very hard. They'll solve your problem. And then I, Brad Sherman, take the credit. It's an outstanding system. Give us a call if we can be of any help. Now, at the outset, there have been a few things going on here in Washington, and I will try to cover them quickly in this opening statement. When I first, we set up these telephone town halls many, many weeks in advance. Many of you got a mailer about it that had to be printed in December, and at the time we set this up, it was mostly to talk about the new COVID relief bill that we passed in December. So a although other things have happened since then, let's remember what's in that bill. The first thing is a $600 per person, same amount for adult or child, stimulus payment. Many of you have gotten these from the IRS. If you haven't received your stimulus payment, or you didn't even get the first one from the spring, the best way to claim it is to fill out your 2020 tax return. You don't have to wait till April 15th, and you can claim it on that return and increase your refund. Keep in mind that the credit is, or the payment is phased out if you're a single person who makes more than $75,000. It begins to phase out, and at $100,000, it's pretty much down to zero. Likewise, for a married couple, it begins to phase out at $150,000. If you make more than $200,000 as a couple, it's pretty much gone. The next thing that's in the bill is extra unemployment benefits for both employees and gig workers. But now that's on top of your regular California state unemployment insurance benefit. The bill we passed in December, though, does not put $600 a week on top of your regular benefits, but only $300 a week. And that was controversial. And later in this conversation, we'll talk about new legislation that has been proposed that is more generous on that. And then the other thing to keep in mind is that extra unemployment benefit is only extended through March 14th. Again, we'll talk about pending legislation a little later in this call. The December bill provided a second PPP forgivable loan for businesses and nonprofits with under 300 employees. The amount you can borrow is roughly 2.5 months of regular payroll, unless you're a restaurant or a small hotel, in which case it's 3.5 months. So the first step is to get your first loan, which was available since spring, get your second loan, which became available in December, and then your next step is to take the steps so you can turn that loan into a grant that you do not have to pay back. And I'm sure we'll get some questions about the details of that. And I have on my website, click on and that website is bradsherman.house.gov. Click on New Coronavirus Bill, and then there's a section on information for small businesses. The new bill also provided, this is a December bill, provided over $60 billion for vaccine distribution, COVID testing, contact tracing, $25 billion in renters assistance. It extended the eviction moratorium through January 31, which seemed like just a 1-month extension, but that got us to the new administration, which is now already acted to extend that till March 31. And then there's money for food assistance, child care, airlines, and $82 billion for the schools. Almost nothing in it for other state and local governments. So that's what I thought we would be talking about. That was my 7-minute opening statement, except as you may have noticed, some things happened earlier this month. And I will take a minute to describe it from my own viewpoint. On January 6th, the House and Senate was to assemble to count the Electoral College votes from the states, each one in its own sealed envelope, and we already knew it was inside the envelope. I knew there were thousands of Trump protesters in Washington, D.C., and expected them to be outside the Capitol and be quite boisterous, so I got to work quite early that day and was in the Capitol complex, which is defended at various checkpoints by very serious people with very serious weapons. And since the War of 1812, no one has illegally pushed their way into this Capitol. So I felt that once I was inside, I was safe, we were all safe. And that the most exciting thing would be to see what I was there on the floor to see. and that is how Vice President Pence would deal with the first challenge, and they go in alphabetical order, and the first state challenge was Arizona. You may have watched on the news, you saw Vice President Pence handle it in a professional, constitutional manner. And at that point, I went back to the office. They don't want us staying on the floor too much because of COVID. I had seen what was supposed to be the most important event of the day. Later that day, 20, 30 minutes later, the crowd rushed the entry points. Unbeknownst to them and me, the Capitol Police had been instructed not to use deadly force. If you see the kind of force they sometimes have, they're sometimes machine guns. It doesn't give you the image of a police force that isn't going to use deadly force, but they did not use deadly force. And this group rushed the Capitol. They broke the windows. They rushed in. I was back in the Rayburn House office building where I am right now, which is connected to the Capitol through underground tunnels. In fact, the Capitol complex is really not only the Capitol, it's the famous building, but about 80 other buildings connected in a security system through underground tunnels. We were told to shelter in place, and that's exactly what I did for about 7 hours quietly in this office. Nobody banged on the door. I do not think any of the rioters came to our hallway, and their real focus was on the Capitol building. At the time, I did not know, and I would have been even more concerned if I had known, it's come out since, that there were those in the crowd with these, in effect, plastic handcuffs that were there to imprison members of Congress, that there were those in the crowd shouting, hang Mike Pence, or where's Nancy? And so while not everyone in the crowd was bent on deadly violence or on physical violence toward people, some were. And in any case, as you know, they were cleared from the Capitol complex. We stayed here. We did our job. We counted each state's electoral college votes. We certified that Joe Biden and Kamala Harris were elected. We did it in the right place and the right time, and in fact, we finished at around 4 in the morning, which was when I thought we would finish had there been no such disturbance. And the reason for that is the Republicans, instead of challenging 4 states, challenged only 2. Each state challenge takes about 3 hours to deal with. In any case, we went on to January 20th for the 7th time. I was present at an inauguration. This was the smallest and the largest. We had only about 2,000 people there, maybe 3,000. That's about 1% of what I've seen in the past. And at the same time, in terms of importance, this might be the most consequential inauguration since Lincoln in 1860. I would, at around 7:40, I'm going to take a bit of time to talk about the legislation that President Biden has proposed and the executive actions he's taken, although maybe those matters will come up in our questions. So we're going to hear from our medical expert, who will be with us on the call to take questions. Some questions will go to the doctor, some will go to the congressman. We also have some written questions that were submitted on our webpage, and if you're interested in these town halls in the future, you go to bradsherman.house, for House of Representatives, it's bradsherman.house.gov. Click on Town Hall, tell you whether there's a town hall scheduled, if there is one. It'll tell you how to participate and also how to submit a written question in advance. In addition to the oral questions and the written questions, we're going to have survey questions so that even if you're not asking a question I respond to orally, you'll be able to give us your input by being included in our surveys on 5 issues of public importance. So one way or another, I'll know what's on your mind, at least as to some questions. So at this point, I know this is scheduled to go for just an hour. We will probably go an hour and 10 minutes. If we go much beyond that, they charge us a whole lot of extra money. We have with us, again, by popular demand, Dr. Lynn Goldman, who's a member of the National Academy of Medicine, was recently quoted on CBS News nationwide. She's on the governing board of the National Academy of Sciences as an advisor to the CDC and the FDA. And as I said, is both a pediatrician and an epidemiologist. Dr. Goldman, tell us a little bit about the COVID crisis and how you think that's going to develop in the future.
Thank you so much. So one thing that was certainly a highlight for those of us in public health, actually, in the inauguration, was to see everybody wearing masks, distancing, doing what all of us have been advised to do, and having that example set by the president, the vice president, and everybody on the platform, congressman. That makes a big difference, I think.
Not only was everyone there socially distanced, socially and everyone wearing a mask, in order to be out there, you had to be tested within the prior 24 hours. A whole testing system was set up. So, and even though we all knew that everyone around us had been tested in the prior 24 hours, we were all socially distant and all wearing masks.
Wonderful. It is true, though, that yesterday we did have across our country 184,700 some cases, which is down a little bit from the very peak, which was a little more than 200,000 a day. And so we are seeing a bit of a decline in numbers of cases from all the cases that were generated from holiday travel and get-togethers. We also yesterday had 4,367 deaths from COVID in the country, or at least that's the most recent count I saw. And that's a manifestation of a little bit of a decline nationwide, and that's also true for positivity. Unfortunately, for Southern California, although there's some modest declines, we're not seeing the same rate of decline as we see in the rest of the country. And we still see that the ICUs, especially in the LA area, are jammed with people, including a lot of COVID cases. And so, although nationally the epidemic seems to be cooling down a bit, your region is still having quite a bit of transmission. And the other thing that I think is important is that while we're seeing this bit of a decline, we don't know where it's going. And so there's a lot of discussion about that, but we can debate that endlessly because we have no way of knowing where it's going. Certainly it will go down to another level, but is that going to be as low as the level as what we had before this current climb in cases started sometime around October? Or is it going to reach a new higher plateau where there's still a lot of transmission? We don't have an answer to that. But a piece of this, Congressman, that's so important is that we're increasingly observing virus mutations in the viruses that are being transmitted. And this is something that your constituents have asked me about before. Can it mutate? What happens if it mutates? And in fact, we do see now across our country not only evidence of some of the mutations that have been seen in other countries, like in the UK, but we also see maybe some novel mutations here in the U.S. But so far, the mutated viruses actually seem to transmit better, meaning that it's even more important to use masks. They seem to be better at latching onto the cells on the inside surfaces of our nose and infecting us. But the masks do prevent that, and the distancing does prevent that. They don't seem to be more lethal. In fact, these mutations may be a little less lethal, because another thing that we're seeing is a trend, and it's kind of an epidemiological mystery right now, but even though we have a lot of hospitalizations, the rates of death are a little lower, what we call case fatality rates. Now, that could be because these mutant viruses are a little less lethal, but it's also true that our treatments are getting better. We understand better how to give intensive care and other respiratory care to people with the virus, Frankly, we're not so quick to put people on ventilators anymore. We're still using those monoclonal antibodies that we talked about before, which do seem to be helping people. And so it's quite possible that we're seeing a lower case fatality rate because the viruses are a little weaker, but it's also possible that we're seeing a lower case fatality rate because our treatment is better, and I happen to believe that it's probably a combination of both. The concern that I heard actually earlier this week from the White House, the old team that's going out, is about all the National Guard members who are in the Capitol. And as careful, Congressman, as you were in the inauguration platform and people have been inside the House, when you see how those Guards members are barracked in the Capitol, they're very close to each other. And it could well be that they could be transmitting and bringing the virus then back to the communities that they came from once they return. What everybody seems to be worried about right now
people should know there are 26,000 National Guardsmen and women from all over the country. This Washington, they're leaving beginning today and tomorrow. But this was the most militarized area I've ever seen, unless you're actually on a military base. And it's a shame that that was thought to be necessary. And I just want to paint the picture for you a little bit. That's about 5 times as many troops as we have in Afghanistan and Iraq combined. So this is a very militarized area here in Washington. Go ahead, Doctor.
Well, I was on our campus in Washington, D.C. on Friday, and it really did look like a war zone. Checkpoints and so many uniformed people. Literally, to make the inauguration safe, it was like an occupied zone. I've never seen D.C. looking like that. But I wanted to talk a little bit about the vaccine, and that is the concern that all of us have about the rollout and the commitment that the administration is making to speed that up. We know that in the U.S. as a whole, only 4.5% of the population have even received one vaccine, or at least that's the most up-to-date data I could find. And it's a little bit lower in California, 3.4% who have received one shot. And everybody is focused on the percentage of the doses that have been used. So those doses allocated to the state of California, for example, only about 37% have been used. And that's the throughput, moving the vaccine down the conveyor belt from the factory to shipping it to a point of distribution to getting it into people's arms. I happen to think that a bigger problem is the top of the funnel, increasing the rate of production of the vaccines, that it's inevitable that there is going to be a little bit of stickiness moving the vaccine through, and probably California could speed it up, but that we need to ramp up the production, and that seems to be a commitment that we're hearing from the Biden administration. How feasible that's going to be, how quickly they can do that, I'm not really sure, but I think that, so far, the vaccines work against the virus, even the mutant versions that are out there. But I personally am concerned, and I think I've heard this concern from Dr. Fauci as well, that a slow rollout of the vaccine could create an environment in which the virus will evolve to mutate to be able to escape from the vaccine and force us to start all over again with making new batches of vaccine that go after the new virus. And so I think it's so important to speed this up.
Doctor, I think we should move on to questions for both you and me.